This presentation is about attention deficit hyperactivity disorder. So what is ADHD? ADHD is a part of the classification group known as neurological developmental disorders. Intellectual disabilities, communication disorders, and autism spectrum disorders are also a part of this classification group. ADHD is defined as a persistent pattern of inattention and/or hyperactivity, impulsivity that interferes with functioning or development. Attention deficit hyperactivity disorder is the most identified psychological disorder among school-aged children and adolescents. So it's probably fair to say that we all know or have worked with someone who has been diagnosed with ADHD, and we have seen how ADHD affects their everyday functioning. ADHD is characterized as deficiencies in executive functioning skills of behavioral inhibition and self-regulation. Individuals diagnosed with ADHD have symptoms of hyperactivity, impulsivity, and inattentiveness. Typically, the hyperactivity and the impulsivity are the initial observable behaviors that cause concerns in the school and home environment. So parents and educators are probably going to see some differences in the hyperactivity and the impulsivity of their child or student versus the normal average child or student. The externalized behaviors that can be observed from students diagnosed with ADHD are the inability to sustain attention to academic tasks, resisting short-term interest for the sake of longer-term goals. So they're not going to be able to, think, oh, let me do this now for that long term. They've got to be taught how to do those things. Generating intrinsic motivation, so that internalized motivation that keeps a lot of people going to the next step to be better, they oftentimes don't have. Understanding consequences, lack of planning, and then of course that excessive motor activity that is so common that we see in school environments and home environments. So unfortunately, these externalized behaviors, which are also called non-normative behaviors, can produce some negative outcomes for the student who is diagnosed with ADHD. Oftentimes, these externalized behaviors cause an inability to acquire appropriate social skills. There's an inability to attend to social cues. And then, of course, it hinders opportunities to fully participate in academic setting, because oftentimes these are kids that are being removed for disruption of a classroom. And then the results in deficiencies, so these non-normative behaviors result in deficiencies and maladjustments in social and academic developmental stages. So because of this inability to grasp social cues and social skills and not participating in academic environments, you're going to have, as they develop through their stages, there's going to be those deficiencies that happen. All the social and academic deficiencies and maladjustments that I just mentioned cause students with ADHD to be at an increased risk for many other disorders or many other negative outcomes. So you've got anxiety, delinquency, dropping out of school, substance abuse, academic failure, expulsion, suspension, retention. Oftentimes, because of their inability to understand social cues, they're targets for bullying, low self-esteem, and then of course you have the depression. Typically, students diagnosed with ADHD require academic accommodations and behavioral supports within the school environment, and oftentimes that even transitions into the home environment as well, those behavioral supports and accommodations and strategies to utilize with the student, even in the home environment. The teachers' and parents' willingness to work with the students and implement the needed strategies and supports plays a vital role in the student's success. And then again, on the same note, you've got teacher and parent resistance and negative attitudes toward the accommodations, implementing the strategies and accommodations, negative attitudes toward the ADHD diagnosis altogether. It's going to negatively impact the student's achievement, which is probably going to play part, even a bigger part, into those negative outcomes that I discussed earlier. There are many factors that can affect the manifestation of ADHD in the school environment and at home as well. Interactions with adults, with peers, it can affect all of that. You've got medications and their side effects, comorbidity, and then teaching strategies used in the school and home environment, or the lack of teaching strategies utilized in the school and home environment.
Attention deficit hyperactivity disorder is a high-incidence disorder among children and adolescents in the United States. Factors such as diet and maternal behavior do not seem to contribute significantly to the presence of ADHD, but the family characteristics and cultural context are being looked at as possible variables in predicting the outcome in hyperactive children. Research doesn't show that diet contributes significantly to the presence of ADHD, but there are some parents who think otherwise. On the last slide of the slideshow, there are links with discussing different topics within ADHD. The first two links discuss diet and parent opinions about how diet affects ADHD. It is suggested that ADHD occurs in most cultures in about 5% of children and about 2.5% of adults. Of this 5% of children, it's estimated that 66% of them take medication. Stimulant medication has the most empirical support for managing ADHD symptoms among preschool-aged children through adulthood. The most common are Adderall, Ritalin, Concerta, Dexedrine, and Xylert. An antidepressant, Strattera, has proven effective for some children with ADHD, and some high blood pressure medications may have similar results as well. That's being researched right now, but the proven methods for improving ADHD symptoms in children are the 5 medications that I named above. Concerta and Adderall have been found to be effective over longer periods of time. Approximately 75% of children with ADHD respond positively to initial doses of stimulant medication. The most notable improvement has been seen in the areas of attention span, impulse control, reaction time, and fine motor coordination. All of these improvements are associated with increased academic accuracy and production in school-based settings. Stimulant medication has been shown to improve the social interactions of children by increasing compliance, decreasing disruptiveness, and improving responsiveness to others. They have also been found to improve the social judgment and interpersonal interactions in adolescents. Stimulant medications have many potentially negative side effects, like most medications do. These side effects include insomnia, drowsiness, irritability, loss of appetite, chest pains, liver damage, uncontrollable body twitches and verbalization, growth depression, and an increased risk of substance abuse. Comorbidity and ADHD. Well, what is comorbidity? It is the combination between anxiety and attention deficit hyperactivity disorder. Very little is known about comorbidity other than it leads to psychological and medical conditions. The combination between ADHD and comorbid anxiety disorders occurs in 30 to 40% of children diagnosed with ADHD. It is referred to as ADHD. Children with ADHD and anxiety disorders are seen to suffer from substance abuse in their later adult years. This was also with children taking medication for ADHD. Little has shown to be an effective treatment. Parent training has shown improvement in parent-child relationship, but little neurological change has occurred.
Hello, my name is Kelly Blanco, and I will attempt to discuss some effective interventions for students with ADHD. I've included a little picture here that says thoughts fly lightning fast. Can you control them? And the teacher is apparently frustrated at the child's lack of focus. And it's hard for students with ADHD to um, focus while the teacher is up there, and they have so many thoughts that they have to sort through. So academic interventions can be extremely helpful to this student. So I'm going to attempt to discuss some interventions, and these are not all of them, but just a few. Peer and parent tutoring. Peer with another peer. It's helpful for a student to discuss um, with their peers what's being learned in the classroom and how other peers are learning, and being able to hear their explanations. Parent tutoring happens when the teacher meets with the parent and almost has a lesson with the parent, so that the parent can help their child, maybe during homework at home, teaching them the skills as the teacher has taught in the classroom. And so this helps the parent to be more confident and able to help their child. Teaching relevant skills such as note taking or math skills or math tricks or study skills. This type of intervention is very helpful, especially when a child gets to their independent work. Teaching those strategies and math tricks, that in study skills, so that they know how to do a certain math problem. They can easily refer back to what they learn and how to decipher those problems. Graphic organizers, planners, calendars, timers. These types of interventions help with managing time and managing thought. A graphic organizer is anything that is appealing to the student. I've seen, you know, um, tree maps and clouds with raindrops, and I guess it just depends on the age of the student as well. Shorten assignments, grouping tasks, giving explicit instructions, giving task choices. I've seen choice cards being used, and it may have 6 boxes on that one sheet, and a student can pick any 3 boxes, any 3 assignments to complete on that sheet. Shortened assignments can be, one day they do all the odd number problems, the next day they do all the even problems. And giving explicit instructions, that would be, very specific instructions, step by step even, so that the student doesn't get lost in what steps or what needs to be done. Sometimes the student doesn't even attempt to begin an assignment because they got lost during the instructions. So that is something that can be easily done as an academic intervention. Shortened assessments and allowing for frequent breaks during testing. Shortened assessments, again, sometimes tests are very long for a student with ADHD. Instead of 20 questions, maybe shorten it to 15. As long as you can assess if the child has mastered that skill. Allowing for frequent breaks, that would help the child to not get as distracted and release some energy as well, and therefore keeping the frustration low. So that would help during testing. On this next slide, I've included a little picture again. As you can see, the student is looking at the teacher, and the teacher is saying, "Take your pills and focus." And he's looking at her, and he's looking at the board, and it says boring stuff and blah blah blah. And meanwhile, he's got all this other stimulation that's going on in his brain as well. Um, it's very hard for a student with ADHD to function in the classroom. Um, and very often the student is not on medication, so it can be very frustrating for the teacher as well, but probably more frustrating for the student. Um, so especially when a student is not taking medications, uh, everything that can be done needs to be done for the student. So I've included some more classroom strategies. I found a YouTube video, and the website is insideadhd.org. I've attached the link. If you just right click it, it should take you, and then you choose to open it, it should take you to the video. But I'm going to share some points that I found were important on the video. And I really encourage you to watch the video. It's an interview with a 5th grade teacher who is implementing classroom strategies for students with ADHD, and I really was impressed by that. So the first strategy he uses is preferential seating with reminders to stay on task. So it's very important that you identify students that are having difficulties focusing, especially those kids with ADHD, and you may need to sit them close to the front of the room or next to the teacher's desk, and reminders to stay on task. It may be a tap on the shoulder or a tap on the desk, or a visual reminder, making eye contact with the student. And the teacher also recommends that, based on the student's need, possibly seating the child in the back of the room, to help with overstimulation. Again, I guess it's just based on the individual need of the child. The next strategy he mentions is fidget tools used for focusing and releasing energy. He does go into some detail about that, and I appreciated that because sometimes fidget tools cause more distraction. So something that he mentioned was discussing the purpose of the tools with the students, and just because it's maybe, fun looking doesn't mean that it's appropriate for you, the student. So including the child in the process of choosing a fidget tool is very important. Checklists and graphic organizers. The checklist, I like that he said, he laminated the checklist and kept it there on the student's desk so that the child can use the checklist, maybe at the beginning of the day to make sure he or she has the materials needed for the lesson or needed for the day, and he or she can check it off. Or at the end of the day, make sure you have your reading homework, your math homework, have you included your take-home folder, and so each day the child can use a dry erase marker and can check it and then wipe it off. And so I thought that was very helpful. And again, he mentioned graphic organizers during writing time. Also, directions given in manageable chunks. he mentions that he writes the directions on the board and then chunks them for the student. And I thought that was good because a lot of times teachers get so busy that they, orally give the directions, and a student gets very distracted in the next couple of minutes and forgets what did the teacher say and gets distracted. So I thought that was neat to write the directions on the board. These were just some of the points that were mentioned in the video, so I encourage you to check that out. On the next slide, I'm going to talk about behavioral interventions. I've included another picture. It says, I wouldn't say your son is a bad child. He's gifted at disruptive behavior. And it's sometimes hard on the adults in the child's life to remain positive and not get so frustrated. Oftentimes, the student with ADHD demonstrates the most challenging behavior, so it's important for the adults to try to separate the child's behavior from the child's potential to learn. Again, these are just a few behavioral interventions. There's so many resources available, so I'm just going to cover a few on this slide. Teaching and reviewing class rules frequently. We discussed this, especially for the beginning of the year for teachers. They go over the rules, the first week, and then they expect a child to learn them, have them down, and know how to act. And so we need to remember that we need to constantly teach and be the role model that the student needs, the reminder that the student needs. Also, the rules can be readily available for the student, maybe on the child's desk, maybe using a note card or index card, or even a laminated sheet with some of the rules that are important to that student to remember. So to constantly review those rules would be beneficial for the student. Effectively giving directions, and briefly and with focus, we talked about that. Making sure that student understands the directions is important for behavior, because if a student does not know the steps or doesn't know what is expected, then they easily lack focus and turn their attention to something else, something more entertaining, which is probably not what the teacher is wanting. Visual reminders and cues and verbal praise. Again, the visual reminders could be the index card or the rules taped to the student's desk, or the cues could be pointing to a specific rule, or giving a crossing their arm, for the teacher to cross her arms across her chest as a cue. Keep your hands and feet to yourself, or it could be anything that the student responds to. Verbal praise would be done immediately when the student has displayed the desired behavior. Students with ADHD need to know what is expected and what's desired, and if they receive that verbal praise immediately, then you can bet that type of behavior will continue and strengthen. So I think verbal praise is important. Having an organized classroom helps with behavior as well. If a student is sort of lost in the classroom, meaning overstimulated, maybe there's chaos in the classroom, maybe there's it's unorganized. They don't know where their papers belong, or where to put certain materials, or even if there's a lot of uh, decoration, posters on the wall. Sometimes that can lead to overstimulation and can cause the student to um, lack focus and feel overstimulated. So having an organized classroom can help with behavior as well. Maintaining motivation is important. This is something that I truly believe in. Keeping the student with ADHD motivated is probably the biggest uh, key to the student's success. And this can be done, through getting to know the student, finding out what his or her likes are, dislikes, what they're interested in, what they're willing to work for. Um, Maintaining motivation, even just high five, for a student is a big motivation. So if you can capture that kid's attention, capture that kid's motivation, then they're going to work for you, and their behavior, maybe their behavioral problems are going to be kept at a minimum. Also, high interest content. This helps with maintaining motivation as well, but if you include a student's interest into the lesson, if a student is interested in wrestling, then they're going to want to hear about that story about a certain wrestler, of course, if it's appropriate. But, or if they like race cars, then they're going to want to use, maybe you can use toy cars in a math lesson. So something that would keep the kid interested. Then you're definitely going to keep the kid engaged in learning, and that's going to help with behavior as well. Having a token system or reward system, this is something that can be done class-wide, but also could help that specific student with ADHD, because a lot of times, this student wants to feel that it is motivating them, that it is appropriate for them, that it's important for them. They want to feel important, and a token system helps with that. Uh, a token system can be anything from points to stars, happy faces, certain check marks. All of that can help, and once the points add up, it leads to rewards that a student has already expressed a desire for. If the student knows this type of reward is waiting for them, then they're going to work hard to get to it. So this kind of system is helpful with behavior. Also, a daily report card. This can be done like as a progress report for a student. It goes home. It concentrates on maybe one or two desired behaviors, and the form goes home daily so that the parent can review it as well. And also, you want to include the student so that self-monitoring can occur, and that student knows what has been done, what is expected, where they're going. It helps them to have a goal and to work towards that goal. So I like that daily report card. It gives the student that extra attention that they may need to help with the behavior. Again, these were just a few behavioral interventions. A behavior plan as well, and including having a support system for the child with ADHD is important, and including that support system in the plan for the child. Definitely include a teacher, a counselor, principal, parent, so that everyone is on board and acts as a support system for that child with ADHD. On the next slide, I've included another YouTube video. Again, this one was found on InsideADHD.org, and it discusses some behavior management strategies for children. It's geared more towards parents, but I would recommend it for anybody who is involved um, with a student with ADHD. So it could be parents, teachers. Um, it probably should be viewed by teachers maybe during an in-service. I liked what was said on the video, and I'm going to discuss just some points. Um, and I just put a little picture there. He's not naughty. He's got ADHD. And sometimes it's hard to recognize that and separate the behavior from the child. But with some work and with some strategies, we can help these children with ADHD. So I recommend that research is done by a counselor or by a therapist or by the parent to help their child that has ADHD. So one of the points that was mentioned on the video was don't reward bad behavior. It's very easy when the adult is frustrated with the child's behavior and, maybe says, okay, here's the candy, now go, or if you stop behaving this way, I'll get this for you. Well, we're so quick to react to the behavior, but we need to, instead of rewarding the bad behavior, reward the positive behavior and the desired behavior. So he mentions how to do that. Practice active ignoring. This one's very hard. It's very hard to ignore that behavior, but he suggests that, you have a simple conversation with your child and say, once you stop behaving this way, then we can discuss whatever it is. But, until then, we will not talk about it, or we, whatever it is, we won't go there, or, as long as you practice that active ignoring instead of reacting quickly and saying, okay, here it is, or, just stop. Practice that active ignoring. So that's a strategy that can be difficult, but it seems like it could be effective for obtaining that desired behavior. Setting good examples. Any adult in the child's life is a role model to that child. And so it's important that we remain constant for that child. They're monitoring us at all times. So reminding teachers and adults, parents, counselors to remember that these children are modeling after us. So we need to remember to set good examples for them. If they know that we are behaving a certain way, or we're not reacting a certain way, or we're not choosing this type of behavior, then they're going to want to do the same thing, because it is just natural for a child to want to please their parent or an adult. Also, to be organized and plan ahead. And this is important for teachers and for parents. And, any kind of downtime or free time in the classroom is very hard for a student with ADHD. It's important to remain organized and to have, these activities, centers, things that the child knows can be done and things that are acceptable versus free time. I'm going to run around the room and, act silly and therefore getting in trouble because of their bad choice and behavior. So planning ahead also can help with that. preparing their child, if we know that there's going to be a program at school the next day and our schedule, the routine of things is going to be off, preparing that student so that they're aware and they know what is expected can help with behavior. For parents, if they're going on a long road trip or if they're going to see the doctor or something like that where they know it's going to cause anxiety for their child, then have some calming techniques that they can refer to, or play a little game of if you're on a road trip. I mean, how many license plates did you find from different states? Something to keep the child um, engaged, motivated, um, so that they can choose desired behavior instead of acting out. Um, Again, these were just a few behavioral interventions that I found. There were an abundance of resources available, and I encourage any adult, counselors, teachers, therapists, parents, to research all these available resources and assist those students with ADHD, um, so that they can be successful um, in school and in life. That concludes my portion of this section. I hope you enjoyed it, and I hope that you go out there and find some more resources. There's a lot out there. Thank you.
Here are several more ADHD-related links. View the ones that interest you on your own time. Are there any subtopics in ADHD that you see as problems in the future? And if so, what are they? The first video discusses possible causes associated with ADHD. Many parents think if they change their child's diet, especially omitting foods that contain certain dyes, that will help with ADHD. So there's a 2-minute video from CBS News about that. The second video is from NPR. It's 4.5 minutes long. It discusses diet along with medication as well. The third link is to another CBS News video. It discusses, actually it's from 60 Minutes. It discusses the use of ADHD drugs when you don't have ADHD. They talk to some college students who would take Adderall or Ritalin to be more focused while they were taking tests or writing papers. And they have some research that go along with that. That was pretty interesting. And the last link is to an NPR discussion where they talk about a spike, especially in adolescent boys, in diagnosing ADHD over the past couple years and what the possible reasons could be for that. This concludes our slideshow. Thank you.